Alright guys, this is the Chapter 3 portion of the medical terminology section of the course that you've chosen, and today we're going to be talking about suffixes. This is going to be a pretty short chapter, guys, but we're going to go over quite a bit of information. So some of the things that I want to make sure that you guys know and learn after this presentation is I want you guys to be able to identify and define useful diagnostic and procedural suffixes, and we'll talk about that. I want you to analyze, spell, and pronounce medical terms that contain diagnostic and procedural suffixes, and then apply those medical terms into real-life situations, because that's really what you need to get out of this portion of the course, is being able to take these medical terms and then implement them into the medical world. So suffixes are divided into two groups, diagnostic and procedural, and you'll hear these two terms over and over and over again. Diagnostic suffixes describe diseases or conditions, or their symptoms, okay? So it's an illness, injury, or disease, okay? That's what it's referring to. Procedural suffixes describes procedures used in patient care, whether it would be like a surgical procedure or a type of treatment. So those are the two main differences, and it's important to know the differences because you will see those throughout the entire course. So diagnostic suffixes, so the illnesses, the diseases, what the doctor tells you is going on with you. We have algia, which means pain, like neuralgia is nerve pain. Anemia is a blood condition, so anemia would be a blood condition without. IA is a term that means condition. Itis, you'll hear it all the time. Hepatitis, appendicitis, okay, that means inflammation. Megaly is an enlargement of a gland. Oma is a tumor or a mass, like a neuroma would be a tumor of the nerves. A carcinoma would be a cancerous tumor, those types of things. We have osis, which is an abnormal condition, or a condition of. An example of this could be like nephrosis, which would be an abnormal condition of the kidneys. And then pathy, which means disease condition. Then we have rhea, which is a flow or a discharge. Rage, spelled R-R-H-A-G-E, is excessive. And then ragia is a discharge of blood. So those are close, very close words. Not much difference in the spelling, but they all have different meanings. So it's important to be able to match those terms up with appropriate meanings. And then we have sclerosis, and that means hardening. So like arteriosclerosis would be hardening of the arteries. And then urea is a condition of urine. Okay, so each of these terms here means pertaining to, and you're going to hear pertaining to a ton throughout this course, a ton throughout your medical careers. Those could be AL or EAL, they mean pertaining to. AR means pertaining to. ARY means pertaining to. IC means pertaining to. And those aren't all of them, guys. There are more that mean pertaining to. So those were the diagnostic suffixes. Now I'm going to talk to you about the procedural suffixes. So these procedural suffixes are procedures or treatments done. And these suffixes include synthesis or synthesis, however you pronounce it, and that is a surgical puncture to remove fluid. Then you have ectomy, which is a removal of, a resection or excision. For example, appendectomy or cholecystectomy, so a surgical removal of the appendix or a surgical removal of the gallbladder. You will see that one a ton, guys. These two are very close. It's important to know the difference. You have gram and graphy. The gram means record, and graphy is the process of recording. So like an electrocardiogram is a record of the electrical activity of the heart, whereas an electrocardiography is the process of recording the electrical activity of the heart. So there is a difference there. It's very slim, but there is a difference. You need to know it. Lysis is the separation, breakdown, or destruction. And plasty is a surgical repair or surgical correction. So if you go and get a rhinoplasty, you're basically getting a nose job. You're getting a surgical repair of your nose. Scopy. Okay, you'll see this one a lot, and there's some variations of scopy that you need to be aware of. Scopy is the process of visual examination, where stomy is opening. Let me actually go back to that last slide real quick, see if I can do that. There we go. Scopy. I want to talk more about this one. Scopy is the process of visual examination. Okay, scope, S-C-O-P-E as a suffix, is the instrument used to visually examine. And then scopic is pertaining to visually examining. Okay, so there is a difference between all three of them. I know the other two weren't listed here, but they were in the previous chapter, so that is should just be a little bit of a refresher, but that is an important one to know. Therapy is treatment, so chemotherapy is chemical treatment. Anatomy is an incision or to cut into. And that's it, guys. That's it for your procedural suffixes for this chapter and diagnostic suffixes for this chapter. If you have any questions, feel free to let me know. Make sure you update these into your Quizlet and you get your study guides done. Those Quizlets are essential, guys. They will help you prepare, and you can take those anywhere and study and practice as much as you want. So if you have questions, please feel free to come up and ask me. Call me over, whatever you need. Have fun with your studies and keep working hard.